begin.
Hello, my name is Yomna. I'm one of the foundation year doctors here in the clinic. Am I talking to the mom of Alex?
Yes, doctor.
How are you?
Oh,
Nice to meet you here. Can
thank
you
you.
please confirm his name and age?
Yes, he's Alex Johnson and he's 6 years old.
Okay, nice to meet you. I have understanding that you are having some concerns. May I be aware of them?
Well, doctor, Alex is losing weight lately in the last few months, and I don't know what's going on with him.
I'm very sorry to hear this. Can you please answer my questions, like when exactly this started?
Well, over the last few months, maybe the last 6 months.
Okay, so how much does he lose?
Well, I didn't measure his weight, to be honest,
Mhm.
but I feel like no, this is not his usual.
Okay, I understand. Okay, there is any changes in like the size of clothes or something?
Yeah, yeah, yeah.
Okay, I understand. Okay, anything specific happened before this?
Uh, Nothing specific happened, no.
Okay, does this associated with fatigue?
Well, I feel like he's always tired, yes.
Mhm. Any lumps or bumps in his body?
No,
No. Okay, that's reassuring. Any weather difference preferences?
no,
Okay, any recent the problem in his bowel or urine?
no.
Does
Same,
he goes to what? I'm sorry.
same bowel motion.
Okay. Does he goes to the toilet frequently for urination?
Yeah, this is what I've noticed lately, doctor. He's
Mhm.
drinking a lot and going to the loo a lot.
Okay, I understand. Does he have any medical condition should I be aware of?
No,
Any medications regularly?
no,
Any allergies?
no.
Any family history of same conditions like drinking or frequent urination?
Uh, well, no, not that I'm aware of. No.
Mhm. Okay. Do you happy with his development so far?
Uh, well, yeah, so far he's doing well, but apart from the last 6 months,
Yes. Okay. What about his vaccinations? Did he
yeah, he's
take
up to
them?
date to his vaccinations, yes.
Okay, that's very assuring. Do you have any idea what might be causing this?
Well, I'm thinking about anemia, doctor. It could be anemic.
May I ask why do you concerned about this?
Well, this is my understanding. I know that anemia can cause, losing weight and being
Mm.
fatigue all of the time.
Okay, would you mind if we discuss this after examination?
Well, okay, yeah.
Okay, do you have any other concerns?
No,
Any expectations at all?
no.
Okay, thank you for answering my questions. Do you mind if I examined his weight and height and also general examination for his body, all of his body? Also, I will check like the sugar levels and also I will take a urine test. Is it okay?
All right.
Thank you. Okay, thank you for letting me examine your child. I can see that from the tests that I have found, a little bit the sugar is in the high level. So this is unfortunately making me considering that he has something like diabetes. What do you feel about this?
Diabetes. I know diabetes. Do you mean diabetes? Diabetes, doctor?
Okay, I'm understanding this. This is might be frustrating for you, and I understand that you are a mom of a young child, so this might be stressful for you. But let me explain what we are having today. Okay.
Okay, doctor.
Okay, I'm glad that you're bringing your child today. That diabetes in his age, unfortunately, means that his body cannot produce enough insulin, so that he cannot like control the sugar in his blood. But it is a manageable condition, and we with be committed to the treatment. We can manage this, and we can like prevent any other complications. What do you think about this?
Is it anemia? Maybe it's anemia, doctor.
Well, we didn't have like the all the tests results. It can be, but we have the sugar test, so we are completely
2 minutes
sure
remaining.
about the diabetes. But I will consider also the anemia, and I will make you updated. Do you want to just talk about the management plan so that we can manage the condition, or what do you think?
Yes, yes, please, doctor.
Okay. First of all, I know that you are facing a new challenge in your life, but with the commitment with the medication, we will be in a safe place. First of all, I can urgent transfer you to a specialist so that you and him will decide, will be aware of the optimal dose of the insulin, and the child will take this insulin on a daily basis with an injection of a pen. Do you understand me so far?
Uh, well, when I'm going to to the specialist, doctor.
Okay, the urgent refer is within 2 weeks, but by we oh, no, sorry, on the same day, so that we can just be reassured about the dose, and the child will start the medication from this moment.
Okay, and you told me insulin, uh, an injection. Can he take it orally? I mean, some liquid instead of injection.
Unfortunately, there is no formula of insulin that can be took by mouth, so we should stick to the injection method. I know it might
Move
be
on
like,
to the next station.
Thank you, Dr. Yumna.
yeah,
How do you feel?
not that good, and yeah, but I have tried at least.
Okay, I'm happy with the try. To be honest, I'm happy.
Mhm.
This is the first time to practice with me.
Yes.
Yeah.
Mhm.
Again, I'm
Mhm.
happy with that. Okay,
Yeah.
it's a good trial, to be honest. Yeah. So how do you feel in general? What did you find difficult for you in the case to manage? And did you miss anything?
I feel it's just that I'm not that confident yet in the conversation at all, but you have covered everything in the teaching session, so it's not about the information, it's all about the practice.
Okay, all right. Okay, so I'm happy that you've tried, and I'm happy the way you tried to explain things to me, which was really nice and really good. Okay, um, asking the question as well. You asked the relevant questions. To be honest, there is only one irrelevant question. I'm going to tell you what is it. All right.
Mhm.
Um, you need more practice on explaining things. Yeah, and I'm going to tell you few things. If you try to correct them, this would be better. Okay? In terms of
Okay.
uh, okay, from the start, in terms of taking the present history and past history, everything was perfect. Okay?
Thank you.
Where is it? This one. Okay? Exploration, perfect. Uh, uh, differential, perfect. Okay? past history, perfect. Apart from family history, you asked me about family history of similar condition. Well, it here in this context is a bit awkward.
Because it's type 1, not type 2 here, right?
No. The way you asked the question, you told me any family history of similar condition, like going more than usual to the toilet and drinking a lot. It's not proper in this context. You can ask, is there any family history of chronic medical conditions like diabetes?
I can bring it here, right?
Yeah.
Mm-hmm.
Yeah, you can bring it here. Okay? Any family history of chronic medical conditions like diabetes or maybe cancer? You can ask these questions. Okay. This is your history taking. Even if the patient is alarmed, she will tell, cancer doctor? Diabetes doctor? Then you tell her, well, okay, I can see how you are concerned about this, but it's just routine questions we ask when the child is presenting with these symptoms. Okay? All right? So don't be afraid of asking the questions that are relevant to the situation. Yeah? Okay? So this is the only question that I felt it was awkward. Yeah? Apart from that, immunization, development, ideas, concerns, examination, perfect. Okay? Management. Your explanation was good, to be honest, all right? But when you gave me the pause, you told me, what do you feel about this?
I think that you have been so long in the pause, so I want to just ask any other question.
No. When the patient is showing that you told him something which is shocking, okay? Don't tell him what do you feel about this. Well, okay, I don't feel good. All right? So you tell him, well, are you okay, Mrs. X? Yeah? This is the first thing that you have to correct.
Yes.
When you give a patient diagnosis, don't tell what do you feel.
Okay.
All right? This is the first thing. When you told me, I can see that you are frustrated. No, she's not frustrated. She's shocked. Okay? So I can see how you are shocked about knowing this. Yeah?
Yes.
Okay? The explanation of diabetes was okay. You can tell her, well, okay, the body of your child is not controlling the sugar anymore, all right, because of the lack of a hormone called insulin. Yeah. And most probably he will take this hormone as a medication. Got me? So your child, Alex's body doesn't control the sugar anymore because of the lack of insulin, and usually he will take this insulin as a medication. Okay? You didn't tell me this part clearly. Yeah?
Yes.
And then you told me we will refer you urgently to, it's same day. In this case, it's not 2 weeks. It's same day referral. All right. Then you told me then they will start him on insulin. Well, what you said is correct. All right. But this mother is shocked about the situation. You have to build her information step by step. Okay? It's awkward to tell the patient, well, he let's say that this patient has a neurological problem, Parkinson's, okay, and he's going to take any name of medications, topiramide, okay, let's say that, Okay?
Mhm.
It's awkward to tell the patient, well, okay, it's very important to go to the specialist so they assess you and start you on topiramide.
Mm.
All right? You
Yeah.
are giving the information right away. No, build the patient's information step by step.
Mm.
Well, Mrs.
Mm.
X, we will refer you, your child, to the specialist. He should be seen within 24 hours. They will assess him and they will give him a medication. Or usually they will start him on a medication. This medication called insulin.
Mhm.
Did you get the point?
Yes.
Got it? Okay.
Mhm.
So take the management step by step. Don't tell the patient everything right away. And this is one of the causes of failure in the exam. I'm not telling you that you are going to fail the case, but
Mhm.
I'm telling you generally uh, what people do exactly can affect their marks. Okay?
Mhm.
I would love if you told me you were concerned about anemia. Uh, it could be cause I prompted you again. I told you, is it anemia, doctor? Yeah. So always pick up the concern and link it to the management or link it to the diagnosis for better management and better marks. Yeah.
Mhm. Okay.
Okay. Um, the other things you covered it all. If you would have time, you can talk with me about teaching about of very low and very high sugar levels and a lifestyle modification.
Mhm.
Okay. Um,
Yes.
so
Okay.
if I were you, this is my management. I'm going to tell you, like the patient or the mother, this. Well, Mrs. X, after explaining things, okay. Well, the next step or the next part of the treatment is sending your child to the specialist for further assessment and starting medications. Usually this medication is insulin. I'm going to talk with you about this in details. Okay. Um, I am going to teach you about the symptoms of very high sugar and very low sugar, okay, and how to deal with them. All right. And also we will talk about some lifestyle modification. Right, Mrs. X? This is the main general point that I'm going to discuss with you. Do you have any questions? Then she will ask her questions. But you highlighted the main things in the management, okay?
Mhm.
And then give the time to the patient to ask her questions and then you answer.
Okay. Got it.
Got it?
Mhm.
Okay, so if I will tell you something which is concerning me in your performance, um, is the practicing more on the phrases that you can say, okay, in terms of
Mhm.
English, yeah, which is it's normal, it's totally normal as a start to have to use the irrelevant phrases or some phrases that are not relevant to the situation. It's totally normal, okay, but I'm giving you an advice on what are the points to correct or what are the things that you can correct in your practice, okay.
Okay.
So using the correct phrases and listening. If the patient has a concern about something, link it to the diagnosis.
Mhm.
All
Okay.
right?
Okay.
Okay. But in general, Dr. Yumna, well done. Well
Thank
done. I'm
you.
happy with your performance as a start. Very good.
Thank you.
Uh,
I
all
want
right.
to ask about the referral. It's urgent referral with like in one day, right?
Yes, same day.
Same day referral. Okay.
Okay. All right.